This session I am going to talk about carcinoma breast management. We'll start with the first question. Breast conservation surgery includes all except. Okay, so first we will discuss about what is this breast conservation surgery. Breast conservation surgery is one of the treatment for early breast cancer. What is this early breast cancer? So otherwise you can abbreviate as EBC. There are four stages are there when you are using TNM staging for carcinoma breast. Stage 1 and stage 2 you can call it as early breast cancer. That means that means T1 and T2 with N0 N1 you can call it as early breast cancer. In other words, you can call it as tumor size less than 5 centimeter with or without nodal involvement. You can call it as early breast cancer. For early breast cancer, two treatments are there. One is called BCS. Another one is you can call it as MRM, that is modified radical mastectomy. What do you mean by BCS? BCS, it is a type of surgery. It is not a single modality of treatment. There are three modalities of treatments you have to do. Number one is called surgery, that is lumpectomy. That is, you can call it as a removal of the lump. There are other terminologies also there for this lumpectomy. One is called tylectomy, or you can do wide excision, or you can do segmentectomy, that is segment of the breast along with the breast lump, or you can do quadrantectomy. Okay, so many terms are there, but all together you can call it as a breast conserving surgery. It is a surgical part and it is mandatory to include radiotherapy because you are removing only the lump, so there is more chances to get the recurrence. So when you are giving radiotherapy, so that can be prevented. And last important thing is you can include the axillary lymph node dissection. So these three component has to be included in the BCS. When you are giving BCS means these three treatment are mandatory. Axillary lymph node dissection based on the N stage. If N0 is there, you can plan for sentinel lymph node biopsy. If N1 is there, then you can plan for the regular axillary dissection. The difference between axillary dissection in BCS and MRM is in BCS, along with axillary dissection, you are putting the incision. It will be a separate incision. Whereas in case of MRM, you will use a common incision, a single incision, through which you will do the MRM as well as the mastectomy as well as the axillary dissection. Okay, so the answer, these three components come under BCS except chemotherapy. Okay, so with that we'll go to the next question. Again, this question is also about BCS only. BCS is done in all except. BCS is done in all except. So in other words, what are the indications for BCS? As the name implies, BCS, breast conserving surgery, it has to be done in young patient. Okay, so young patient, you want to conserve the breast, you want to preserve the breast, there it is indicated. And similarly, in situ malignancy, that is ductal carcinoma in situ malignancy, it is ideally indicated. Then in carcinoma, ductal carcinoma also BCS can be indicated, but not in lobular carcinoma. The reason is very simple. Lobular carcinoma is, it is multicentric as well as it is having a bilateral representation. So it is not indicated in case of lobular carcinoma. So what are the other indications for BCS? For example, you need a patient consent. So number one, patient consent, because see, I have just a previous question we discussed that three modalities of treatment, it is mandatory. So you ask the patient to have they have to give the proper consent. Second one, you need a good follow up, because if you are missing a follow-up, then definitely there is more chances to get the recurrence. So you need the patient. So you select the patient, they should come for the follow-up. Like a patient highly educated and a patient belongs to high or middle class, middle socio-economic status people. And third one is you should have the facility of RT. Facility for RT is a must one because post-operatively you have to give the RT. Okay, so these are all some indication. Apart from these three indications, these are all indications for BCS. Okay, if you put just opposite everything, it will be indication for MRM in early breast cancer. For example, old patient, if you are getting a patient not giving the consent and patient not following, follow up is not good, and RT center, RT facility is not available, then you can go switch over to MRM. All these things are indications for MRM. Okay, so with that, we will go to the next question. In patient with carcinoma of the breast, chest wall involvement includes all the structures except. Okay, so this is according to TNM staging, chest wall involvement means three structures involvement like ribs, number two intercostal muscle, and number three serratus anterior. Okay, it is not pectoralis major. These three structures you can call it as chest wall involvement. And the stage T4, it is T4A. Chest wall involvement means T4A. Then what is T4B? T4B, it is skin involvement. That means there are three presentations will be there. Number one is the edema. So edema usually it will be represented as pudgy orange, which is nothing but blockage of subdermal lymphatics. Blockage of subdermal lymphatics. Okay, so how you are getting this appearance, which is nothing but the burying of the hair follicles along with the edematous skin. So you can see it looks like a orange peel. That's why it's called pudgy orange. Okay, this is one presentation. And pudgy orange is characteristically seen in case of carcinoma of the breast. Apart from other cause is the chronic breast abscess. Also, you can get pudgy orange. And second one, it can present as an ulcer. Okay, ulceration over the breast lump. You can call it as that is also skin involvement. And third one, nodules. That is satellite nodules over the breast lump. You can call it as that is also you can call it as skin involvement. Okay, next one is T4C, which is nothing but A plus B, which is nothing but A plus B, that is both chest wall and skin involvement. And finally, T4D is inflammatory carcinoma. Okay, inflammatory carcinoma. This is about the T stage. Okay, so these are all stages of T. Next question we are going to discuss about the lymph node state. TNM staging of breast CA with a positive bilateral supraclavicular lymph node. What is the stage? Okay, before going to discuss about this question, we will see about what is this N state. Okay, N1 means it is three components. You just imagine ipsilateral, that means same side, axillary lymph node. Okay, it is an axillary lymph node. Then again there will be, it is a mobile lymph node. It is mobile lymph node. This is N1. Again, N2, you got two components are there, N2A, which is nothing but same thing, that is ipsilateral, axillary, but here it is fixed in nature. N2 is fixed in nature. Then what is N2B, which is nothing but internal mammary lymph node alone. Okay, only internal mammary lymph node, there is no axillary lymph node at all. Okay, what is this N3A? N3A is nothing but it is infraclavicular. That is infraclavicular lymph node involvement below the clavicle. And N3C is it is supraclavicular. Okay. And what is this N3B, which is nothing but axillary lymph node plus internal mammary lymph node. Together you can call it as N3B. Okay, what the question says here, the question says that is bilateral supraclavicular lymph node. Here what in this stage all these things are representing ipsilateral, that means same side. Okay, here the question says bilateral supraclavicular lymph node. That means contralateral supraclavicular lymph node is also involved. If it is contralateral supraclavicular lymph node is involved, then you can call it as a distant metastasis. That comes under M1. Okay. Okay. We will go discuss about MRM. In Petty's MRM, which is preserved? Pectoralis major, pectoralis minor, axillary fascia, intercostobrachial nerve. Okay, before going into the discussion about these Petty's MRM, we will discuss first basically about types of mastectomy. Number one is a simple mastectomy. What is simple mastectomy? Simple mastectomy is nothing but removal. That is, there are three components you can take. One is skin, another one is nipple areolar complex, plus another one is you can take the whole breast. Okay, you can take the whole breast. These three structures you are going to take, that is called simple mastectomy or total mastectomy. And second variety is the MRM, modified radical mastectomy, which is nothing but same. You have to take this skin, you have to take the nipple areolar complex, you have to take the breast, and along with you have to take the axillary lymph node level 1 and 2. Okay. In some cases, you will take pectoralis minor also. That is called as Petty's mastectomy. Okay. Next, Alsted radical mastectomy, which is nothing but along with all these things, skin, nipple areolar complex, breast, and axillary lymph node 1 and 2. Here you will take the axillary lymph node 3 also, and there are two muscles you are going to take. One is called pectoralis minor muscle, completely you are going to take, and pectoralis major, that also you are going to take. Next one is the extended radical mastectomy, that is ERM. Extended radical mastectomy, which is nothing but radical mastectomy plus internal mammary lymph node you are going to take. And last one is super radical mastectomy, which is nothing but radical mastectomy plus internal mammary, supraclavicular and mediastinal lymph node removal. Okay, so these are all types of mastectomy. In MRM, again, there are three types are there. One is called Patties. Patties means which is nothing but removal of the pectoralis minor. All these things are based on the pectoralis minor muscle only. So pectoralis minor you are going to remove, then you can call it as Patties mastectomy. So removal. Suppose if you are going to preserve or if you are going to retract the muscle, so then that procedure is called scanlon. We are going to retract the pectoralis minor muscle, then that is called as scanlon procedure. Sorry, so it is not a retraction, it is you are going to cut the muscle. You are going to cut the muscle and do the axillary dissection and put it back into the original position and then suture the muscle. Okay, that is called scanlon. And Achin class. Achin class is the one where you will only retract the pectoralis minor muscle. There you can do the axillary dissection after retracting. Okay, so Patties three MRM types are there. Patties is pectoralis minor removed. Achin class is retraction of the muscle. Scanlon is cut the muscle and do the axillary dissection and put it back into the original position. Okay, so now we'll come to the question. Patties MRM, which is preserved? Which is preserved? Pectoralis major, definitely you are going to preserve. Pectoralis minor, you are going to take out the pectoralis minor. Just I mentioned here. And axillary fascia, yes, axillary fascia you are going to remove because axillary lymph node dissection you will include fascia, axillary lymph node and pad of fat. All the three things you are going to remove. That is called axillary lymph node dissection. Then intercostobrachial nerve. So this is also most of the time you will sacrifice the intercostobrachial nerve. Okay, so the answer is pectoralis major. Okay, we'll go to the next question. True about MRM. True about MRM. Pectoralis major removed. Okay, just now you discussed pectoralis major. We are going to, we are going to, we are not going to remove. You are going to preserve. Axillary lymph node. You are going to remove the axillary lymph node. Pectoralis minor, yes. we are going to divide. In one type you are going to divide, that is called as scanlon. Okay, scanlon type you are going to remove the or divide the muscle. Internal memory you are going to preserve, you are not going to take. So answer here is the pectoralis minor divided. Okay. Okay, this is the again question related to the post-mastectomy complication. Pain along the medial aspect of a arm in a post-mastectomy patient is due to, answer is a straightforward question, it is a intercostobrachial neuralgia. Okay, so there are some nerves that are involved in while doing axillary dissection. So the most common nerve that is injured is the intercostobrachial nerve. Intercosto, because it will commonly you will come across the, it passes through the axilla. Definitely you have to sacrifice this nerve, and post-operatively the patient will get intercostobrachial neuralgia, which is nothing but the pain will be present along the medial aspect of the arm. And this is the last question. In post-mastectomy, patient not able to extend, adduct, internally rotate the arm, which muscle is damaged? Here the answer is latissimus dorsi, because all these things are action of latissimus dorsi. Okay, so what nerve is responsible? I told there are some nerves are responsible important in MRM. Number one, previous question we discussed intercostobrachial nerve. Number two is the thoracodorsal nerve. Thoracodorsal nerve, which is very important, which supplying the latissimus dorsi. If it is injured, latissimus dorsi will be paralyzed. Serratus anterior, okay, that is also important muscle. The here the nerve supply is the long thoracic nerve of Bell. Long thoracic nerve of Bell. So this nerve, if it is injured, you can have the winging of the scapula. Winging of the scapula. Okay, so what will happen if the pectoralis major is injured or deformed? It produces shoulder deformity. Okay, the shoulder will be in a deformed state. Okay, for pectoralis minor, nothing will happen. Most of the time, it is causing an insignificant change. Okay, because in MRM patties also you are removing the pectoralis minor. Okay, so with that I am closing the session. Thank you.